It is wonderful to be here at the Meyerhoff Senior Center. I am Debbie Wasserman Schultz. Me llamo Debbie Wasserman Schultz. Yo soy su congresista. I'm very proud to be your congresswoman in Washington. So buenos dias, good morning. It is wonderful to be with you, and it is such an honor and a privilege to represent you in our nation's capital. And one of the things that's always so important for me is to make sure that every single day I'm thinking about how to improve the quality of life of our seniors. And that's what we're going to hear, that's what we're going to talk about this morning. But I have something very special that I want to be able to do first. You know, really the best part of my job is being able to help cut through what is sometimes the ridiculous red tape that, that government seems to unbelievably throw in your way for no apparent reason. And when that happens to someone who has served our country and in our nation's military, it gets me even more incensed. So I want to share with you a story of one of my constituents who is here today and who you all get to witness something very special. But after 44 years, my office was able to assist Raymond Place in receiving his Combat Infantry Badge. He was slightly wounded in Vietnam in August of 1968, and he was transferred to Japan, where he rehabbed and then re-enlisted. But he has tried 4 times since 1968 to be able to get and be awarded his Combat Infantry Badge, and was not able to. But we worked hard on this case because I knew that Raymond absolutely deserved this badge, deserved to be honored and recognized for his service to our country. And now I get to award him with the Combat Infantry Badge right here at the Meyerhoff Senior Center. So let me thank you all for being here today. I want to spend a few moments on this just to give you an idea of what Raymond has been through. He was wounded while serving in Vietnam in 1968, and it is long overdue, but I'm proud to stand before you today, and if I can ask Sergeant Place to join me at the podium, please. This is incredible. Saying that this is long overdue is an understatement. 44 years to be given the Combat Infantry Badge that you so rightfully earned, where you served our country honorably. We welcome Raymond back to South Florida, where he moved in 1979. I know your wife Christina and your daughter Elizabeth live here in Hollywood. But at the end of the day, we need to make sure that when our nation's veterans come home after their service to our country, that we honor them, that we lift them up, and that we cherish them and make sure that their life and their pathway back as they transition back to civilian life is a smooth one. And that's what President Obama and Democrats in Congress, and me included, have been fighting so hard to help our veterans from Iraq and Afghanistan as they come home. That didn't happen with our Vietnam veterans. No. It was a travesty what happened to our Vietnam veterans. You after 44 years with what you so rightfully deserve, the Combat Infantry Badge. Congratulations.
Thank you so much for your consideration and your hard work with getting the medal for me. I'd just like to remember all our fellow veterans, all our DAV guys. These are all guys that are all combat wounded, combat veterans as well. Okay. And for those of you that don't remember, we lost 58,000 men in Vietnam. That's a lot of guys. I have a good friend of mine I graduated high school with who's on the wall. I have his paperwork over there, but it's a little tough to go through that. But I was in country in 68. He went in 69. He lasted 59 days before he got hit and killed. So George T. Farrell was his name. He'll be forever young. He's on the wall. And I'll always remember him. But thank you so much.
Thank you so much, Sergeant Place. Congratulations. Can I just ask all recognized for your service to our country. If you're a veteran, please stand. Thank you all so much. So now, I wanted to come here today because keeping seniors safe, making sure that you aren't taken advantage of, making sure that you're kept physically safe from harm, whether it's from criminal wrongdoing or from physical harm, is an incredibly high priority. Safety, whether it's the safety of our children, the safety of our seniors, the safety of people who are frail, or the safety of people who really need assistance in order to be able to remain safe, has been a paramount concern for me. And that's why I wanted to put together this series of senior safety fairs, so that we can give you a one-stop shop, really give you an opportunity to hear from all kinds of different organizations that will give you good tips and advice on how to remain safe. But before I do that, I want to acknowledge a very special constituent of mine, someone who deserves recognition not only because he has reached 102 years old and is still going strong, still coming to my events and my town halls, but was the founder of a business in my district in Davie, Bob Roth's New River Grove. Let me introduce and congratulate Al Roth. You're welcome. You're welcome. So we already know that from an economic and healthcare perspective, seniors are a vulnerable population. And for example, a report that was released last week by the AARP found that 1/3 of Florida's nearly 3 million seniors live entirely off of Social Security. No other resources but Social Security, an important safety net that we need to make sure we preserve. And on the healthcare front, many seniors are struggling to pay medical bills and long-term health care expenses. And I know when I'm home every week that I talk with seniors in my district, seniors like all of you who live in my congressional district, about the important needs that you have. And I'm going to talk about that more in a moment. But seniors are vulnerable when it comes to your general safety as well. Whether it's fraud scams or falls or other accidents, as Beth talked about, to fires in the home, seniors face greater challenges as you age. And I'm sure many of you know exactly what I'm talking about. For example, according to the FBI, older Americans are less likely to report a fraud because they either don't know who to report it to, or they're too ashamed at having been scammed. I can tell you so many seniors I've talked to who are just ashamed that they got taken advantage of, or they don't even know that they've been scammed. Older adults are twice as likely to suffer injuries or lose their lives in fires or falls than the rest of the population. And according to the Centers for Disease Control, more than 33%, that's a third, of people 65 and older are involved in accidents and falls at home every year. That's why I've assembled local resources to meet with all of you, to answer your questions, and to provide you with valuable information to protect you. So I'm pleased to have with us representatives of various organizations: S.H.I.N.E, serving our health insurance needs of elders, the Senior Medicare Patrol, the Social Security Administration, the Aging and Disability Resource Center, Nova Southeastern University School of Pharmacy, the City of Hollywood Fire Department, Hollywood's finest, the City of Hollywood Police Department, also Hollywood's finest, and the Coast to Coast Legal Aid of South Florida. Before I turn our Senior Safety Fair over to these wonderful groups of experts, I want to give you a quick legislative update on what's been going on in Washington since I was last here. It has certainly been a challenging first year of the 112th Congress, and we've got a lot of important work to do in 2012. In the last Congress, Democrats worked tirelessly to improve and grow our economy while protecting our seniors, children, and the middle class. And to that end, you remember we passed historic health care reform, which is already strengthening Medicare and ending the worst insurance company abuses. When it's fully implemented, and for the first time in history, all Americans will have access to quality, affordable health care. For the first time in history. Very important. Thank you. The legislation also provides many important improvements to Medicare. which I know a lot of you probably don't realize. So I want to walk you through some of those important reforms that will help seniors from the Affordable Care Act. What healthcare reform really means for Medicare beneficiaries is this. The Affordable Care Act was one of the most important laws to pass in a generation, really since Medicare. But there's been a lot of misinformation out there about what it means for seniors. If you're on Medicare, I am here to tell you that it will improve the quality of your care, and it will save you money, and in fact it already has. In 2010, Medicare beneficiaries, which had high prescription drug costs, how many of you get your prescription drugs from Part D, from regular Medicare, Part D? Okay, quite a few of you. So the donut hole, the prescription drug coverage gap that exists in the prescription drug Medicare benefit today is going to be closed, thanks to the Affordable Care Act. In 2010, yes, that's good news. In 2010, if you got your prescription drugs from Part D, you received a $250 check in the mail to start to make up for some of those costs. Last year, thanks to a new 50% discount on brand name drugs, 2.7 million seniors have already saved an average of $569 on their prescription drugs. And now we're going to close the donut hole completely over the next 8 years. That percentage goes up on the discount that you'll get on brand name drugs this year. You're going to save more than $3,000 as a senior on Medicare Part D in your prescription drug costs. Now I've stood online so many times behind senior citizens who live in my district, who will have the pharmacist bring 5 or 6 prescriptions to the counter. And I've stood online behind seniors who have had to leave 1 or 2 of those behind because they couldn't afford them all. Or when they order their refill on their prescription, they ask that the pills be scored, that there be a line put through the pill so they can break them in half and double the length of time that the prescription lasts. That is not how we should take care of our seniors in the United States of America. And now we don't have to do it that way because the prescription drug donut hole will be closed, thanks to the Obama administration and the Affordable Care Act. There are also a number of things that will help seniors with preventive care. Because you know what has bugged me for years? Representing this community in the state legislature and in Congress for the last 19 years, I've always seen seniors use healthcare and access the healthcare system, go to their doctor when they're sick, when there's something wrong. Well, if we make sure that you can go to the doctor when you're still healthy, if you get a wellness visit free every year to just get a checkup, just like kids can, then we can make sure that you stay healthy and we can make sure that we catch your healthcare problems earlier. Now for me, as a breast cancer survivor, no one knows that better, the importance of early detection, better than I do, because I was able to catch my breast cancer when I was 41 years old a few years ago, as many of you know, very early. And that's because I had access to good health care. And I could go right to the doctor and make sure I could get it taken care of. Well, seniors need to be able to do that too when you're well, not just when you're sick, and now you can, thanks to the Affordable Care Act. Many of you in this room and 24 million seniors nationwide will now pay nothing for preventative services like mammograms, like colonoscopies, and the free annual wellness visit that I just mentioned that will keep you healthier longer. So it does all of this while also extending the life, extending the solvency of Medicare for another 8 years. Now to sum up, when we put this plan into law in 2010, it was designed to improve the quality of care under Medicare while also limiting the amount that seniors have to pay out of pocket every year. The Affordable Care Act stands in stark contrast to several proposals that House Republicans have offered in this Congress. Out of the gate last year, the House Republican leadership brought to the floor several bills to completely repeal and undo everything that the Affordable Care Act has done to take care of seniors, of young adults, of women. If these bills would become law, it would reopen the donut hole in prescription drugs and cause that coverage gap once again, costing seniors thousands of dollars. It would again force seniors to pay for preventative care, and it would strip the protection for seniors in the Medicare Advantage plans that prevent excessive costs from private insurance plans. But these challenges to healthcare reform are not the only way that my colleagues across the aisle are putting seniors' security at risk. Last April, you might have seen a lot about it in the news, Republicans under Budget Chairman Paul Ryan rolled out a budget that includes nothing short of a termination of Medicare. If it ever became law, which President Obama and Democrats in Congress will prevent from happening, but if it ever became law, Medicare would be turned into a privatized voucher program, requiring seniors to go buy private insurance and cover any additional expenses on your own. That's what would happen if the Republican plan for Medicare were allowed to become law. According to the nonpartisan Congressional Budget Office, over the next 10 years, the Republican plan to end Medicare would more than double a senior's typical out-of-pocket expenses. That's a $6,000 a year increase in what you would pay. And in 20 years, it would triple your out-of-pocket costs. That is unacceptable. It's something that I will fight tooth and nail every day that I serve you in Washington. It's dangerous and wrong to assume that someone living on a fixed income, like a senior citizen, can afford the premiums and the out-of-pocket expenses that higher wage earners often pay for private insurance plans. That's why Medicare was created in the first place, because we need to protect seniors and guarantee your access to quality health care so that it fits your budget. For exactly those reasons, we made sure that the Affordable Care Act would cap those out-of-pocket expenses, even for private insurance plans. Seniors and all Americans should have certainty in your health care expenses. You need to know what something is going to cost you. You live on a fixed income, you've got to make sure that you can count on fixed costs every month. Here in Florida, we have 3.3 million Medicare beneficiaries, with more than 862,000 right here in South Florida. And additionally, 60% of Americans in nursing homes are on Medicaid, so Medicaid cuts that the Republicans have proposed would have a dramatically negative impact on our seniors. Many seniors would lose their ability to remain in nursing homes, and hardworking families would have to bear the brunt of costs associated with caring for elderly or ill family members. This is simply not a funding issue. Medicaid also provides federal standards of care and enforcement of those federal standards to make sure that Medicaid-certified providers protect the health and safety of patients. I mean, how many times have we seen horror stories about facilities that really weren't up to the standards that we needed to make sure that they were taking care of their patients? The Affordable Care Act makes sure that those safety measures remain in place. The federal government made a commitment to each and every one of us that when we get older, we wouldn't have to live in poverty or force our children into poverty in order to care for us. That's the safety net that we've committed, through which we're not going to let any American fall through. And I can tell you that I will fight every single day to preserve that safety net for my constituents. Thank you. Thank you. Now, for decades, Americans have paid into Medicare with the expectation that the federal government would honor that commitment. And I am not going to stand by and let my constituents or any Medicare beneficiary to lose their health care security for any reason. And certainly not to pay for Republicans' efforts to shower tax cuts on the wealthiest or give multi-billion-dollar tax breaks to the oil industry. That is not and should not be our priority. In conclusion, I want to thank you so much for the privilege that you've given me to represent our community in our nation's capital. I will continue to work hard to make sure that all of this progress doesn't disappear, that we don't focus on the well-being of people who are already doing well and make sure that they can do even better, at the expense of making sure that we can give everyone in America an